So hello friends, in this video we will discuss some of the clue words or the hint to make out the diagnosis. Okay, so if you're coming across these words, you can clearly mark that as the answers. Okay, so first question is, here the microscopy shows in spaghetti and meatball appearance, and SD culture shows in fried egg appearance colonies, and here the urease test is positive, and the woodlamp shows in golden yellow fluorescence. Okay, so and here there will be in clinical history like the hypopigmented patches or the hyperpigmented patches usually present in the chest or the the trunk region or the chest or the back. Okay, so these are the most common sites. I know you guessed the answer, right? So here the organism, it is in Malassezia furfur. Okay, so and they can ask anything. It can be either causative organism, or the disease caused by this Malassezia furfur is nothing but it is an it is a tinea versicolor. Okay, so but these are the terms they will be usually giving in the question paper, and these are the usual ticks. Okay, so nothing will be asked other than this. It is white nodules which is present on the hair shaft which are less firmly attached. Okay, so here you want to note the color of the nodules. If it is a white nodule, the diagnosis is different, and if it is a black nodule, again the diagnosis is different. Okay, so you want to know which is a, they have to mention the color of the nodules, and I'm sure they will be mentioning the colors in the examinations too. Okay, so next now we will coming for here the white nodules present on the hair shaft. So here the key point is which is usually less commonly attached. Okay, so here that is an if it is a white nodule, it is in trichosporon. Okay, so there are n number of species present in the trichosporon, but here the most common the causing disease, it is in trichosporon bigili. Okay, it isn't firmly attached to the hair shaft. Then it is an this is another diagnosis, that is in Pietra horti. Okay, so but both the disease, these will be occurring in the hair shaft. So subcutaneous swelling, discharging sinus, and subcutaneous swelling, discharging sinus, and the presence of the granules usually present in the okay, so if there is a triad of these three, then it is surely it is a mycetoma. So again you want to know here, if it is they have given mycetoma, sometimes they will be giving the granules color too. That is, if it is in white, or it can be in they can give in a history of like black colored, or it can be a white to red, whatever they can be given. So and there are two types of mycetoma you want to know here. One, it is an eumycetoma, and then it is an actinomycetoma. So the eumycetoma, it is caused by a fungus, whereas actinomycetoma, it is usually caused by a bacteria. Okay, so there is a n number of organism. Okay, so eumycetoma, it produces a black granules like Madrula mycetomatis, Madrula drusia, Exophila gensalme, and Carvilleria. And white granules are Pseudo Aliceria boyeri, Aspergillus mutulens, Acrimonium, and Fusarium. Okay, so what I am saying here is, so just remember actinomycetoma. Okay, so you know if it is an if it is an you know already what is a bacteria and what is a fungus. So just remember here pink to red colonies is produced by Actinomycota pelliteri. Right, so rest are all it will be producing in white to yellow granules. Okay, so they won't be, and I'm sure they won't ask that much details also. Okay, so just remember this alone. Pink to red is produced by Actinomycota pelliteri, and white to yellow most common it is in Nocardia. Okay, so just remember these are the okay, that is enough. Just highlighted, no, and just remember these species alone. That is more than enough. Okay, So but here I can't help you. You want to read the all. Okay, so there is a black granules and neet is in white granules. Okay, fine. So for white granules you can remember like platelet activating factor, that is a PAF. Okay, and here for black granules you can remember mechanical engineering college. So the black peoples so are mostly studying in the mechanical engineering college, whereas white granules it is in platelet activating factor. This is only one is enough. Okay, so next question is cigar shaped asteroid bodies which produces an hyphae with conidia arranged in slender hopefully which is conidia arranged in flower like pattern, and there is a slender hopefully phenomena. So here the clear cut the answer will be in it is an sporothrix shinke. So how you may diagnosis? The first it is an what is that flower like pattern. Okay, it is always arranged in like a flower. Second, there's the main point over here. It is an asteroid body, and the another it is a Spender-Hopley phenomenon. So here you want to remember the Spender-Hopley phenomenon. It is nothing but it is an histopathological finding that is usually the fungus is surrounded by an entangled structures of the eosinophils and etc. Okay, so this is you won't remember this. So always remember the asteroid bodies and flower-like pattern arrangement and Spender-Hopley phenomenon. It is in sporothrix shinke. And some other point they can give us a history of a thorn prick. Okay, if a farmer went to the rose garden and had a recent thorn prick. After that, he developed an a swelling in the area, and we collected these samples and we did histopathological stain. It shows an Spender-Hopley phenomenon, and on LPCB it shows an flower-like pattern arrangement of conidia. Okay, so if it is like they have given like this, then it is an sporothrix. So again, there will be history of a nasal polyp which usually reveals an the spirules. So here the answer is an always remember there will be a history of any any bathing in a swimming pool or bathing in a contaminated pond. Okay, so then in a higher answer will be in Cyanosporidium seabury. And here the main point you want to remember is the nasal polyp will be having an spirules, and that will be containing an endospores. Okay, so but the history will be same only. Then I'm sure that the history will be like the patient went for bathing a contaminated pond, and after that he developed a nasal polyp. Okay, so next question is okay. So first here at 25 degrees Celsius it produces in tuberculate macroconidia and thin microconidia, and 37 it produces in its cells. Okay, so always remember tuberculate macroconidia it is a specific for the histoplasma capsulatum. So none other species produces an what is the tuberculate macroconidia. So if you come across the word what is that tuberculate macroconidia, you can mark it up histoplasma capsulatum. And another point you want to remember here is they will be giving a history of any pulmonary infections. Okay, so because histoplasmosis usually causes a pulmonary histoplasmosis, it is a most common. Okay, so again it is a misnomer. The name contains a capsule, but it is a not capsulated. Okay, so it is a non-capsulated organism. So pulmonary histoplasmosis it is the most common, but I'm sure if they are asking any histoplasma, this point will be there. That is, it is an tube. It produces an what is the tuberculate macroconidia, and yeast is in at 37. So next point here is single broad-based budding. That is a figure of 8 appearance. You know, right? There's a famous mnemonic, you know, right? 8 is like B, capital B, and it is an, what is that? It is an blastomyces dermatitis. Okay, so here, surely they will be giving this point, that is a figure of 8 appearance or single broad-based budding will be there, and here there will be history-wise there is nothing much to be given, and it usually causes in skin infections too. Okay, so as the name implies, dermatitis, there will be some history of any skin infections. So here, if you come across the term barrel-shaped arthrospores with interconnecting segments, then it is an okay, coccidioides emetus. So what I am saying here, these are the key points. Okay, if they are asking this question, I'm sure you will come across these words. Okay, that's okay. Coming for next question, you know, right, Mickey Mouse appearance or the pilot wheel appearance. What is that? It is an paracoccidius. Paracoccidiosis. Paracoccidiosis brasiliensis. Okay, so here they will be giving this what is it, Mickey Mouse appearance or pilot wheel appearance, and it again usually most commonly causes an skin infections. So they will be giving a history of skin infections, but I'm sure they won't be that much specific. Okay, so they can give some of the pictures which shows Mickey Mouse or the pilot wheel appearance. So what is a causative organism? Okay, that will be given, and you can make out it clearly. So there will be some key points over every question. That is, you want to pick out that key point to make out the diagnosis. If you make out that, it is very easy to rule out the questions. And coming for next question, it is a germ tube test positive. Talma plate culture produces chlamydospores and pseudohyphae with budding yeast cells. This I have repeated n number of times. It is nothing. Whenever you come across a germ tube and pseudohyphae with budding yeast cell, it is nothing but Candida albicans. So they can give history like what is that? It usually if now HIV patient had an oral thrush, and on examination there was a coated tongue with a whitish membrane, and LPCB or gram stain showed an what is that, budding pseudohyphae with budding yeast cell, germ tube test positive. If there is a germ tube test positive at the point of exam, close your eyes and mark it as what is that, Candida albicans, sorry. Okay, so they can give history like this one, like the patient was immunocompromised and HIV, and there was an oral thrush, and they can also give a term called as a chrome agar also, but I am not sure, but sometimes they can ask, because the chrome agar, it is also specific for the Candida which produces green colored colonies. Okay, so, but it is a very rare usually, but if they use the term chrome agar was also positive, means then also you can go for the germ what is it, Candida albicans. But if they are asking for Candida albicans, I am sure germ tube test option will be given, and the chlamydospores. Okay, so again here the Niger seed agar and bird seed agar used to demonstrate the mammalian production, and we will be using an India ink strain. What is that? So India ink strain, it is for the capsule production, and it is nothing but Cryptococcus. So here you want to remember, whenever you are coming across the melanin production or bird seed agar or Niger seed agar which produces black colored colonies, what is that, mucoid colonies. So in the bird seed agar and India ink is positive, and again the history, HIV history will be there, and CSF sample are examined, and we found out the that encapsulated bacteria, encapsulated fungus, the history will be there. Then it is in Cryptococcus neoformans. Okay, so always remember this point, India ink strain and Niger seed agar. So coming for here, the frothy exudate in the alveoli or plasma cell pneumonia, and this on what is the crushed ping pong ball appearance against a green background. It is a Gumari methylamine smell, and I think it is a recent question in FMG exam, I think they asked. So if you come across this point, that is in crushed ping pong appearance, everything, it is nothing but it is a pneumocystitis. Okay, fine, pneumocystitis jirovacii. But whatever it is, okay, so they will be giving this point. I think If you go through the recent question paper, they have given this term. They have given exactly this term. Okay. So coming for this brick red pigment, and if they are saying some history like again here HIV patient, because the fungal infections are most commonly seen in the immunocompromised patients, so they have given a culture like any the brick red pigment produced in the culture. You can mark it as it is an penicillium morphi. Okay, fine. Again, I want to say another point, and Sonimocystis jarvis, that Girovisi, they have as the treatment. What is the drug of choice? It is in cotrimoxazole. So you know, right? So here, Penicillium morphi, they have given the clue. What is that? Pig, pigment. It will be producing in the SD agar. So coming for aseptate hyphae with wide angle branching. So friends, always remember aseptate hyphae, it is nothing but mucormycosis. So in mucormycosis, you know there are three species, right? One is a rhizopus, another it is an absidia, another it is an mucor. So these three are species which will be it is broadly coming under the mucor. Okay, it is usually comes under the family zygomycosis, but for diagnosis, I'm saying just it is a mucormycosis. Okay. So here what you want to remember here is there will be term always aseptate hyphae with wide angle branching. So again the differentiation rhizopus will be having a rhizoid, whereas mucor does not have any rhizoids, and absidia will be having an internodal rhizoids. So if they coming across a mucormycosis or zygomycosis, whatever it can be, so you'll mark that is also okay. It can be mucor or it can be in zygomycosis. Okay. So here, whenever there is a history of mucormycosis or zygomycosis, they'll be giving a history of any diabetic ketoacidosis patient. Okay, or any patients on the desperoxamine, that is an iron therapy. These patients are more shown for the mucormycosis. So I'm sure their history will be given, like in a what is that? The aseptate hyphae with wide angle branching. It was seen in the KOH or it can be seen in LPCB. But this is a term. If you come across this aseptate hyphae with wide angle branching, it comes under the zygomycosis family. That is RAM, RAM, right? Rhizoid, rhizobus, mucor, or it can be an what is it? Absidia. Okay. So coming for next, it is an if you want to know species identification, friends, I have posted a video in my channel how to identify zygomycosis. You can go through that, and again for Aspergillus also I have made that. Okay. So next it is in dichomatous branching with acute angle branching. Whatever term they can give, yeah, it is an Aspergillus. Okay. What it is an acute angle branching. Okay. So whereas that mucor, it is in wide angle branching, here it is an acute angle branching. And for Aspergillus, I'm sure they'll be giving a history of any pulmonary infections or it can be any skin infections, whatever it can be. Okay friends, I will be posting the link of that how to differentiate the Aspergillus species and the mucor species. Just go through that. Okay, so if they have given LPCB picture, they can also give like this. If they the patient was suffering from diabetic ketoacidosis and his blood sugar was above 250 and ketone bodies were positive, and on LPCB we showed aseptate hyphae with white angle branching, and the LPCB picture have been given below. Just they will give the picture of the organism. That can, you want to know how to identify the picture, right? So I'll be posting the link of that video in my description box. Kindly go through that also. Okay. That's all friends. So again, dermatophytes, you know, right? There's a three species. So first it is an trichophyton, microsporum and epidermophyton. So always remember, trichophyton means three. It will be affecting three. That is in skin, hair and nail. So microsporum, it is in melanocyte stimulating hormone, skin and the what is it, hair. whereas epidermophyton, it will be affecting on skin and the nail, ESN. I used to remember like this. It is an trichophyton 3 melanocyte stimulating hormone, and here it is an epidermophyton ESN. Okay, so and here you can remember like trichophyton, microsporum and epidermophyton, right? So always remember trichophyton. Tri means it is in color. So tri, it is in color. Tricolor. If you say this word also, tricolor. So the pencil, it is always in color, right? So you can remember like that. So coming for, so here it is a microsporum. Okay, say SP. It is a spindle shaped. Okay, fine. SP. Okay, so which is a left out, it is in club shaped. So epidermophyton, you can remember the club shaped. So trichophyton, pencil. Microsporum, SP, it is in spindle. So here it is an SP. And epidermophyton, again it is in club shaped. Okay. And these are the points you want to remember, and these are the clinical the points or the hacks. You can easily make out the diagnosis. This point will be surely given in the exam. Okay. Some or the one thing or the other. Any clue can be given in the exam to make out the diagnosis. But the one thing is you want to go through the question properly. Okay, that's the main point over here. And friends, I have a Telegram channel for microbiology MCQs. I will be posting the link of the channel in the description box. And if you like my channel, you can join that. Okay. Thank you, friends.